Hi everybody, this is Sean Gray and this is my PowerPoint presentation on relaxation techniques. First I want to talk about the mind's effect on the body and the body's effect on the mind, or the psychophysiological relationship. So the mind's effect on the body. So emotions, thoughts, and stress can produce bodily changes. Stress triggers the sympathetic response, so the fight or flight reflex, which releases cortisol and adrenaline, which can cause increased heart rate, blood pressure, and muscle tension. Anxiety can cause chest tightness, GI upset, dizziness, and headaches. And depression can alter neurotransmitters, leading to fatigue, sleep disturbances, and appetite changes. Now, the body's effect on the mind. So physical health affects emotions, mood, and cognition. So chronic pain can lead to irritability, depression, anxiety. Hormones such as thyroid or autoimmune diseases can lead to mood swings and cognitive distortions. Nutrition, B12, can mimic depression and cause fatigue. So physical and psychological symptoms reinforce one another, but this loop can be broken through relaxation techniques. The relaxation technique that I'd like to talk about is progressive muscle relaxation. This is systematically tensing and releasing different muscle groups of the body. It helps people learn to recognize what tension feels like and how to deliberately release it. It can reduce stress, anxiety, and physical pain. The most critical component is the client's discrimination between the sensations of tension and relaxation. And like anything else, repetition is imperative. Performing progressive muscle relaxation. So you want to find a quiet, comfortable place where you can sit or lay down. You want to start by closing your eyes and start with deep breathing. And then starting with your head and working your way down to your toes, you're systematically going to perform progressive muscle relaxation. The face. So you want to scrunch and wrinkle your forehead, tighten your eyes, and then release. Your neck and shoulders. You can shrug your shoulders to your ears, and then release and slowly drop them back to the neutral position. Your upper arms. You want to flex your elbows, squeeze your biceps, and then slowly release and straighten. For your hands and forearms, you want to clench your fists, squeeze your forearms, release and relax. For your chest and back, you can breathe in deeply, hold, tighten, and then slowly exhale. Stomach and abdomen, you can tense as if you're bracing for a punch, hold, and relax. For your upper legs or thighs, you can bring your knees together, squeeze them while flexing, and then release and relax. For your calves, you can dorsiflex or go on your tippy toes, hold it, and then relax. And for your feet, you can curl your toes downward, tighten them through the arch of your feet, and then release. Each one should be performed between 5 and 10 seconds, and there should be 20 to 30 seconds before progressing to the next body part. You want to make sure you continue to deep breathe and feel grounded. You want to focus on the difference between the tension and relaxation that you feel. What are the benefits of progressive muscle relaxation? Studies have shown that it reduces anxiety and stress, and it activates the parasympathetic response. So the sympathetic response is fight or flight, parasympathetic response is rest and digest. This lowers cortisol, heart rate, and blood pressure, and can reduce physical symptoms of anxiety. Progressive muscle relaxation is also shown to enhance sleep. Performing PMR before bed can decrease insomnia and promote more rested and deep sleep. PMR can counteract depressive symptoms, decrease fatigue, restlessness, and physical discomfort. It enhances mindfulness, so current moment awareness of feeling the tension and then relaxing. It can strengthen coping skills. It's easy to use, it's practical, it can be used anytime you feel overwhelmed, and reinforces belief that patients can influence their mental health and well-being. It also supports broader treatment goals. It can be used in conjunction with CBT, low to no cost, and it's non-invasive. Tracking outcomes of PMR. There's a few different ways to track outcomes. Short term can be the client's immediate relaxation response after they perform PMR, their stress response if they're feeling less stressed after performing the PMR. You can monitor physiological change. Is their heart rate and BP lower? You can use scales like the Single Item Visualized Analog Scale, or VAS, which 0 to 10 for current anxiety and relaxation, as well as patient-reported satisfaction. Do they find it helpful? For long-term tracking outcomes of PMR, one thing you want to ask patients is about engagement. Are they participating in this? You can use the GAD-7, which is anxiety/severity monitoring, and you can track it over a period of time in conjunction with CBT while using PMR. You can also use the Perceived Stress Scale, which is monthly tracking of stress and anxiety. How can this help patients with OCD? So, OCD fuels anxiety and exacerbates compulsions. Like my patient who performed compulsions of checking the door locks in the sink, his sympathetic response would be activated as fight or flight, causing repeat compulsions. As I said before, PMR can activate the parasympathetic response. This can reduce the intensity of anxiety and make obsessive thoughts less overwhelming. Progressive muscle relaxation can be used as a non-compulsive coping behavior to reduce anxiety and provide healthier alternatives to compulsions. Basically, what it does is it interrupts the OCD cycle. PMR increases awareness. So anxiety cues can be noticed before they escalate, and patients can respond in a controlled way versus performing compulsions such as obsessively checking doors to make sure they are locked or make sure that the sink is not dirty. PMR also improves emotional regularity, builds resilience to stress, and can improve sleep. My patient had a difficult time sleeping because they would either have a hard time falling asleep due to worry about if the doors are locked, or would wake up with that same worry. Performing PMR in that moment or before my patient goes to bed can build that resilience to stress and have them focus on sleep, as well as a healthier alternative to getting up and performing the compulsions. That was my presentation on relaxation techniques, specifically progressive muscle relaxation.